In this section, we'll cover two important aspects of your recovery: physical therapy and respiratory therapy, as well as a few other things to expect after your surgery. The morning after your surgery, your nurse will disconnect your IV antibiotics and fluids when they run out. If you had back surgery and had a Foley catheter placed in your bladder, it will probably be removed the morning after surgery. Using your call light, you can request a nursing assistant to help with a bed bath and change into your own clothes. Most patients feel more apt to get up and get moving after changing into their own clothes. We also encourage you to sit up in a chair for each of your meals. Our physical therapists and sometimes occupational therapists will visit you up to twice per day after your surgery. There is no set time other than morning visits occur between 9 and noon, and afternoon visits occur between noon and 4. They will teach you your precautions to follow while you're healing from your surgery, like no bending, twisting, or lifting over 10 pounds. They will work with you on getting in and out of bed, getting dressed, and walking up and down the stairs. If there is anything you're concerned about how you might do when you go home, I encourage you to write it down and bring that list with you to the hospital. Our physical therapist will make sure that you've mastered those skills before you go home. Here's more information from our physical therapy team.
I'm Angie from the physical therapy team at Capital Medical Center. You will receive physical therapy and in some cases occupational therapy after your surgery. Our team will assist and instruct you about how to move safely after your surgery, how to maintain your movement restrictions, and how to adapt your routine activities during your recovery period. You'll have a physical therapy evaluation on the day you have surgery and in some cases, post-op day 1. Treatment will consist of teaching and practicing your bed mobility skills, transfers, and walking. We will reinforce the movement precautions, instruct you on how to use your brace, and teach you how to mobilize safely. You will have physical therapy twice a day while you are in the hospital. The nursing staff is trained to mobilize you in your room, so you will be getting in and out of bed with the nursing staff as well. Your goal for each day will be sitting up for all 3 meals. We will work with the nursing staff to coordinate pain medication for activity. Our goal is to prepare you to mobilize in your home safely and as independently as possible. This will include any stair training, education regarding barriers in your home, and equipment you may need. We will also address mobility for toileting, bathing, and dressing. We will train anyone helping you at home how to assist you safely as well. Occupational therapy may also be provided to address any concerns for activities of daily living. You will have specific movement restrictions following your surgery for the time frame determined by your surgeon. You will need to avoid bending, lifting, and twisting, or as we refer to it, no BLT. Lifting load limits are set by your surgeon. It is generally a 10 to 20 pound restriction. You will be instructed to maintain a neutral spine and engage your core muscles for all activities such as sitting, standing, even brushing your teeth. This places the least amount of stress through your spine and keeps you in good posture. We will also educate you in proper body mechanics for when your precautionary time is over so you can help protect your spine in years to come. Most back and neck patients have a brace prescribed to them. However, this is dependent on your doctor and the type of surgery. Cervical fusion patients typically will have a hard collar on at all times except when showering. Patients with lumbar fusions will use a back brace when you're up, out of bed, and moving around. Your surgeon's office will provide you a prescription for a brace. Walking will be your only form of exercise during your recovery period. We will instruct you to change positions every hour and increase your walking tolerance gradually, up to 2 miles in 3 months. For sleeping positions, neck patients with anterior approach surgery must not recline lower than 45 degrees for the first 2 weeks after surgery. This can be done by sleeping in a recliner or using a wedge and pillows. For lumbar surgeries, you will need to be log rolling in and out of bed. You may already be using this technique as it puts the least amount of pressure on your spine. Let me explain the correct way to log roll. First, bend your knees one at a time by sliding your foot towards your bottom. Second, push with your feet and roll to the side like a log, meaning Move your shoulders, your hips, and your knees at the same time. Let your feet and legs come off the edge of the bed while you push your upper body into a sitting position. From that point, you can stand. When returning back to bed, lower back down onto the bed by reaching back with your arms. When you're ready to lay down, go onto your side with your forearm and bring your legs up and pause. At this point, you can roll like a log. So start practicing. Now let's discuss things you can do before surgery and prepare your home for your recovery. Remove any obstacles such as throw rugs and cords. Make sure you have a clear, well-lit pathway from your bed to your bathroom and plan a route for your walking program. It is typical for lumbar spine patients to use a front-wheeled walker. Your doctor will provide you with a prescription, or you can borrow from family and friends, utilize equipment banks, or Goodwill. Neck surgery patients usually do not need an assistive device, though sometimes a cane is used. Think about where you will sit when you are at home. You will want to avoid sitting in low chairs, and you will want the chairs to have arms. We recommend a supportive, hard back, upright chair. Recliners are okay as long as you have proper lumbar support and are not slouching. For neck patients, you will want to have extra pillows to put under your arms for comfort. Depending on the height of your toilet and the presence of a solid structure to push up from, you may want to consider a raised toilet seat with arms. Consider adaptive equipment such as a reacher, sock aid, and tongs for toileting. Remember, getting up, getting moving, and following your precautions is the key to a successful recovery. The physical therapy team is looking forward to working with you and helping you pave the way for your return to increased activity. You are always encouraged to ask questions during your stay and after, so we can keep you moving towards your goals.
As you just learned, getting up, getting moving, and following your precautions is the key to a successful recovery. During the day, you should be up and walking every hour when you are not asleep. This is a wellness surgery. Two main complications after surgery are blood clots and pneumonia. The best way to prevent these is walking. Walking is your only prescribed physical therapy. Walking will help promote healing in your incision. I encourage you to work with our nursing staff to make sure that you're up and moving more frequently than just twice a day. If you choose to go for another walk in the afternoon, use your call light and the staff can walk with you, get you up in a chair, or help you use the restroom. Now let's move on to another type of therapy you'll receive after surgery: respiratory therapy.
Hello, my name is Tom. I'm one of the respiratory therapists here at Capital Medical Center. After surgery, it is common for patients to take more shallow breaths due to anesthesia, pain medications, and bed rest. This can lead to something called atelectasis, a condition where one or more areas of your lungs collapse or don't inflate properly. A breathing exercise that is designed to mimic your natural sighing and helps to keep you from getting atelectasis is called incentive spirometry. We will teach you this during your hospital stay, but I will demonstrate now. You will want to sit up as far as possible in your bed. Hold the incentive spirometer in an upright position. Exhale normally. Place the mouthpiece in your mouth and make a tight seal. Breathe in slowly and as deeply as you can. Hold your breath for several seconds and then let your breath out slowly. Rest for a few seconds and then repeat the steps. You should do 10 deep breaths per hour. After you have finished your breathing exercise, cough to make sure that your lungs are clear. Another device that will be by your bedside is something called a capnography machine. We use capnography as another tool to make sure that your breathing is okay. This machine is a monitor that makes sure that you are breathing adequately and measures the carbon dioxide in your breath as you exhale. You will also have a small clip on your finger that will measure your oxygen saturation levels.
We've covered a lot of information in this section, but all of it is so important for a successful recovery. Here are the things to remember about recovering in the hospital. Physical therapists and sometimes occupational therapists will visit you up to twice per day to teach you precautions to follow while you're healing from your surgery, like no bending, twisting, or lifting over 10 pounds. Walking helps you heal and helps to prevent complications. Trying to get up and walk every hour that you are not asleep. Keep your lungs healthy by taking 10 deep breaths per hour using your incentives spirometer.